Hello there, my name's Bea. I'm a health coach here at Melbourne Functional Medicine, and I've got Rebecca Hughes with me. Rebecca is our skin practitioner. She supports all of the patients that come through and work with us who have a primary skin presentation. So thank you so much for jumping on this call, Rebecca. What I see from a coaching perspective as being really helpful for people is to understand a little bit about the process of what they might expect when they're working with us to recover from a skin condition, to manage and heal. So a lot of the people who come and see us have been working with dermatologists or other medical professionals, and a lot of the people I know have been using steroids, so either topically or orally using steroids. Could you help me understand a little bit about topical steroid withdrawal and what that might look and feel like?
Let's call it TSW for ease, is where a patient has ceased their medications, like their steroidal medications, that they probably have been on for months, if not years, and consistently using steroids to manage their eczema or whichever skin condition they've been using it for. And because the steroids actually sort of suppress inflammation, and they do it particularly well, is that when you withdraw those medications and you withdraw them suddenly, there's what's called a rebound effect, where the body has to adapt to the lack of that drug moving forward. So until that point, the body is adapted by its immune system being dialed down. And when you take away the thing that's been dialing down the immune system, then there's a huge sort of, the only word I have really is rebound or reactive situation that happens because the steroid is no longer there. And that's why I do encourage all of my patients to actually stay on their steroidal medications when they first start treatment with me, which seems counterproductive when you come to see a naturopath or a functional medicine practitioner. But what I'm trying to mitigate is that exact effect is TSW, because it's different to eczema and it can be extremely uncomfortable. Like patients experience hot, red, like entire parts of their body where they maybe originally never had any eczema at all. And that's why TSW isn't eczema, but it's very difficult to tell the difference when you've already been dealing with hot, red, aggravated, itchy skin, and then you've got another type of hot, red, aggravated, itchy skin, but maybe it's in different parts of your body and persisting for a long period of time, and is often associated with skin shedding, and also has the danger of developing secondary infections, because it can be quite serious.
So it sounds like that could even be a bit confusing if someone's always experienced, let's just say, eczema, maybe in the joints behind the knees, somewhere on the neck, and then they do experience TSW, and now they're having something expressed somewhere else. It would be natural to think that that's eczema.
Yeah, exactly. And then it's even more confusing when you think, oh, but all the things I did before that helped my eczema that are not helping this problem over here.
Yeah, understood. So that sounds like a very mindful approach, keeping someone on what they're already doing, that's managing or reducing that inflammation or that immune response and reactivity. And then you go and do the investigations, and we start finding out about some root cause and doing some corrections. And then is there a little bit of a seesaw action that happens?
Yeah, there's a crossover where we might start prescribing things internally, prescribing things externally, the types of medicines that I prescribe, and then gradually we phase out the use of the steroidals, and we do that systematically, slowly, and understanding what the dose is that the patient's taking each day, each week, before we get down to no steroids.
Actually makes me think of another question, something I see a lot when coaching patients in this group. They're already using steroids, they might be using a moisturizer, they then might be using a topical that you prescribe. What does that dance look like between the different creams?
What I generally advise people to do is whatever you're already doing when you come to see me is keep doing that, and then whatever I recommend, do that last.
When people come to see us and this applies to pretty much every human, that healing is not linear. We'd love it if it was. We'd be able to get this predictable, beautiful straight line. More so with skin patients who experience flares as they move through their treatment process, I notice that this can be quite distressing. Can you explain a little bit about why someone might experience flares and what they might actually look or feel like typically?
The immune system is in all of our blood. Like, we sort of don't think of it like that, but we have immune markers, white blood cells, inflammatory markers, cytokines. They're in our blood with our red blood cells and our white blood cells and our platelets, and they're floating around, which means they're in every single part of our body, and in our lungs, in our skin, in our digestive system. And accordingly, your immune system can then get activated by just about anything. So you might go past a tree that's got pollen that you're reactive to, but you don't know that you're reactive to it. And you breathe in some of that pollen, and your immune system does the right job. It exerts an inflammatory response to that tree, but then those inflammatory markers float all around your body. And if you've got already aggravated skin, then the skin that's aggravated is probably going to get more aggravated. The problem with that is that most of us don't think that way. And so we don't necessarily associate the park that we were at the day before with the skin condition we have today. And so that's just one little example of things that you could be, unbeknownst to you, be exposed to and be aggravated by. Then there's animals and pets and danders. Even if you don't live with a pet, there are chemicals in our environment that we're not always aware of. So when you walk into things like shops and supermarkets, and you might notice this the next time, is that there are a lot of perfumes in those stores. And the perfumes aren't necessarily allergens, but they are something that our immune system needs to respond to, because our immune system is all about determining whether something is threatening or not threatening. And so it has to scope out whether these perfumes are a problem. Then our lymphatic and our detoxification systems have to process those chemicals. So we're breathing in volatile components that are in the atmosphere, and our immune system deals with them, our lymphatic system is exposed to them, and our liver is exposed to them. And so then we have to process and expel those chemicals. So wow. It's complex as to all the things that you can be exposed to that you don't know you're being exposed to, that are influencing your immune system. And because many of those factors we absolutely cannot test for. Like, we can test for food reactions, we can test for some, and many people have had their skin prick testing done, and they know that they have allergies to horses, cats, dogs, pollen, grasses. But even then, those battery of tests are generally quite contained. They're contained to the common allergens that medical doctors and scientists know about. They can't and won't test you for everything.
So if I'm a patient and I know that I've got a heightened immune system, I can see that there's stuff happening with my skin, I live in the world, there are animals and pollutants and things. So that helps me understand that there might be a little bit of variability and volatility, and I might expect that from time to time I will experience some ups and downs. Yes. I guess without cocooning myself, and maybe even from a psychological perspective, if it's not a practical perspective, is there anything that you can think of, or anything that you guide your patients to do around this sort of thing, like the fact that you're in a world with a lot of things that might upset your body?
Well, there are things that we can't control outside of ourselves. There are certainly ways that we can control factors in our home environment. We can use things like air filters and water filters to reduce chemical exposure and to reduce exposure to dust, pollens, danders. If there's known dust allergies, then I suppose there's practices at home that include generally like more vacuuming, more washing, dust covers on mattresses and pillows, reducing soft furnishings such as carpets, cushions, throws, curtains, So basically pairing it back to harder surfaces that tend not to accumulate dust, or if they do accumulate dust, you can see it and it's easy to remove, versus it's quite difficult to remove from fabrics. That'd be some of the things I would say. And then the treatment is also part of the strategy, because essentially what I'm trying to do is remind the immune system how it could behave, which is not over-responding and overreacting to non-threatening elements in the environment. Because whilst it is normal for the immune system to react, once it gets into a state of overreaction and hyper-responding, it then becomes so inflamed and agitated that it starts to react to a range of things in the environment that perhaps it hasn't responded to in that way before. So I guess that would lead me to also then talking about that just because in testing, we might have detected food reactions right here, right now in your health journey, it doesn't mean to say that you're going to be reactive forever to those foods. And so I guess we could say that it doesn't mean that you're going to be reactive to everything forever that you're currently reacting to.
When should somebody seek immediate medical care?
Well, given that I guess particularly eczema is related to the hay fever asthma trilogy of conditions and known to be allergy mediated, it is possible for people to develop allergic reactions and even mild signs of anaphylaxis if their immune system has been ramping up, like if it has been progressively becoming more and more reactive. It is possible, and the hives are an example of this, where people develop hives just out of the blue and they've never had them before. That's generally an indication that the immune system is becoming hyper-responsive. So therefore, it's also possible for other tissues to become inflamed as well. And so the main thing we tend to be concerned about is airways. And the classical first aid picture of anaphylaxis is extreme wheezing and constriction of the bronchioles. And that obviously is a medical emergency. But there's other parts of your airways that can get agitated, and we don't often think of those as something that's urgent. And so it might be that you ate something and your tongue started to itch, or your throat got scratchy and you started to cough. Your tongue and your throat are part of your airways. So if you do start to notice those types of symptoms, I would seek immediate medical care.
Yeah, that makes total sense. And also when we're thinking of someone experiencing skin flares, so you're having a bit of a moment where the skin's reacting more, you've talked about heat and you've talked about redness. Again, topically, at Melbourne Functional Medicine, we're not emergency care. Instead of holding on to information, is there anything that you would say to somebody, go and see your GP without delay for a different skin presentation?
Yeah, if there was a sudden change in the presentation and you developed oozing or yellow and green pus coming from a wound or an excoriation or any kind of open skin, I would certainly go and see your doctor or emergency medical care immediately. The other time is if there was any signs of extreme, and I mean like dramatic swelling of the area. So it didn't just go from being the regular redness, but to swelling. And maybe if you saw that veins, if it's on a limb, you'll notice I'm talking about cellulitis, is that sometimes the veins moving up the limb start to become visible. So it might be up the arm or up the leg. And generally that's a sign of something called cellulitis. And that's because the area has become really infected. And if you have cellulitis, you need antibiotics straight away.
Fantastic. And I know that the other thing that really, really, really helps you understand someone's journey and we ask everyone to do it, is to take regular photos of their skin. And we know that what can happen is in those times of flare, or when things are a little bit, painful or exacerbated, that's when people typically take photos and send us lots of information. And where they perhaps don't share as freely is when things are going really well. What would you like to see from all of your patients?
I would love to see regular photos taken at a routine time. So, and because it's not just the photo of the location, it's also that the same location in the same part of the house, in the same light, on the same day of the week would be really valuable because then we can track your symptoms over time, and then we can use that information in combination with testing data, the treatment strategies that we're currently implementing, to see what is the relationship between what you're doing and not doing, and what we're doing and what not doing, and how your skin is tracking over that time period. And so it gives us consistency and repeatability. So it's good to know, as Bea said, that when it's going well, it's useful to know, and when it's not going well, it's equally useful to know.
So thank you for sharing all of that. That's really helpful. Is there anything specifically you would say to somebody who's going to work with us for how they can get the most out of working with us?
I think there's to manage is the mindset around having a skin condition, and understanding and remembering that before you came to see us, you probably already were in flare and remission cycles, because particularly with psoriasis and eczema, they're volatile conditions, and that's quite normal in the pattern of those diseases, that there's times of great aggravation and times of remission. And as you may not understand why that's happened in either direction. And part of working with us is to help discover and understand that, but that also takes time. We don't get that information immediately, and we discover it through the practitioner-patient-coach relationship. We discover what are the things that are making it worse and what are the things that are making it better. So I guess I would say, like, keeping an open mind is a really useful state to be in, like an inquiring and discovering place, but also with a level of acceptance and understanding that until such times as we've gathered all of that information, what's likely is that you still are going to experience flare and remission cycles. Now, of course, that's not the objective. The objective over time is that the space between your flares becomes longer and longer, and the severity of the flares becomes less and less. And that is indeed what happens, but sometimes it's not so linear. Sometimes it is that you put in a lot of groundwork at the start with testing and food eliminations and all sorts of other strategies, and the work of that inflammation doesn't pay off until you're maybe 3 months down the track. And I would say it's probably around that point in the program that most people start to turn the corner. And as I'm talking about it, I think, well, there's probably a good reason for that, because it does take that amount of time also to alter how the immune system is behaving. Because we talked about the inflammatory markers floating around the body. Part of that are what's called antigen-antibody complexes, especially when it comes to food. And we know that it takes at least 6 weeks for 50% of those little complexes to leave the body during an elimination diet. And by 12 weeks, almost all of them have left the body. And that's particularly if you haven't been re-exposing yourself to the things that you know are problematic. So that's, I would say, often why most people experience a significant turnaround roughly halfway through their program.
Thank you so much for spending the time to watch this video, and we do hope it's given you some great insights into what your experience might be like, what to prepare for, and just know that we're very much here to support you. So communicate with us, share with us what's going on, and we look forward to supporting you back to great health.
Thank you.